Well, I think one of the important things of the Pauley is it gives us a cohesion that we don't have otherwise. When you have a named center, somebody put a name on it. That's important in terms of how everyone sees themselves and the institution sees the program.
The Pauley Heart Center, to me and to our department, is all about collaboration. We've gone miles in the last 5 or 10 years in improving our emergency cardiac care. We've got world-class treatment of patients with heart attack. We've got world-class treatment of patients who've had their heart stopped and gone into cardiac arrest. That's all been possible because emergency medical services, emergency department, and the staff at the Pauley Heart Center have all worked together to make us the very best we possibly can be.
In my work with the ARCTIC program, the Advanced Resuscitation, Cooling Therapeutics, and Intensive Care Post-Arrest program here at VCU, we have the ability to work with our bench scientist counterparts and translate the research that they're doing into the cardiovascular patients, and then also translate what we know about those patients back to bench research so that we can be the first institution in the country, actually, that has been able to characterize the extent of inflammation and injury in these patients.
The Pauley Heart Center has been critical in providing support for research personnel, for critical equipment that lets us pursue cutting-edge mechanisms of this heart cell injury in the early phases of a heart attack, to aim towards developing drugs that will limit heart cell injury after the artery's been opened.
I think for the first time, the Pauley Heart Center allowed us to truly create an entity where we are functionally together and share more common interests for the benefit of the patient. We have gone from being a fairly small device and transplant program to probably one of the top 10 programs in the country. Clearly the top program for the implantation of the artificial heart. And it really allowed us to go out and bring expertise in to grow these programs.
And I'm going to tell you how good we are, because about a year ago August, the president and CEO of the company that manufactures our total artificial heart gave a presentation here to us and presented the world's data. And the leading institution in the world, this is no longer in this country or in North America, the leading institution in the world is VCU.
There are few institutions that have the type of experience and the breadth of experience we have to be able to virtually treat any patient with atrial fibrillation. It is often said that usually at any one institution there may be great skill and depth in surgical ablation of AFib or in catheter ablation of AFib, but it's truly rare to have expertise in both.
In pediatric cardiology, we deal with patients in the fetal state all the way to the octogenarian age range because of congenital heart disease. This can present in the newborn period or be detected in their 60s and 70s, so that we care for patients across the entire spectrum of cardiovascular disease, from prevention to congenital heart disease to acquired heart disease. So it's an ongoing process of evolution, working hand in hand with the adult cardiologists, the adult surgeons, as well as pediatric cardiologists.
For an academic health center, where our role and responsibility is to introduce novel therapeutic interventions. And that's what the Pauley Heart Center is all about. Groundbreaking innovations that we take from the lab to the patient's bedside.
I always like to think that I'm at least a couple steps ahead and can offer several things that patients just can't get anywhere else.
The value is almost unmeasurable because it's measured in these intangibles. Prestige, accomplishments. All right, you want to put a value on it? The world's leading total artificial heart center. That's what they've helped us do.
Mr. Pauley always challenges you to do well. I've called him about things we've just won, awards. What does Mr. Pauley say? That's very nice. What are you doing next? And it's that spirit, I think, that comes into the cath lab where we're doing new things like robotic angioplasty or ablating renal arteries for high blood pressure, new research that could really change the course of how we manage patients. And I think his spirit and his goal for this program really comes down through all the areas.
Collaboration.
Preventing heart failure in the future.
Comprehensive care.
New discoveries.
Raising the bar every day.
Opportunity.
Patient-centered.
Continuity of care.
Excellence and innovation.
Exhilarating experiences.
Outstanding education.
Cutting-edge research.
Cooperation.